Good evening, everyone. I would like to welcome everybody here on another webinar of Wildlife SOS. And today we're all here to discuss something that I'm sure all of us are passionate about, which is birds. And these are animals that, of course, we find birds every day, everywhere we go. These are animals that are, commonly found animals across the world, even. And we have Dr. Adhithyan joining us today, who has been a wildlife veterinary officer at Wildlife SOS for over 3 years now. And Adhithyan is a very, very passionate birder. He can identify over 300, 400 species of birds, I would say. And he's also an expert with birds and mammals. Welcome, Adhithyan. We're very happy to be excited even to have you present to us today. And we're hoping to learn a lot from you in today's webinar. Yeah, you can take over, Aditya.
Yeah, somebody, am I audible now?
Yeah, we can hear you.
Okay. Good evening, everybody. I'm Dr. Adhithyan N.K. I'm a wildlife veterinary officer in Agra Bear Rescue Facility. I've been a vet for last 3 years. I have done some like birding. I'm seriously interested in birding, and I've been getting a lot of calls and pictures through WhatsApp, how to manage a chick, how to treat a bird, something like that. So many questions I used to get. So I think it's an important thing to do now. So to help you out, guys, how to take care of a bird from the beginning stage of a chick to an adult. So I think I can share some information to you guys. Can I share my screen now?
Of course, Aditya. Go ahead.
Okay. So is it visible, Anisha?
Yes, we can see your screen.
Okay. So thank you everyone for being here. Okay. So let's start the session. This is going to be a brief section about the management and management of the wild birds and their nestlings. So the entire process is known as rehabilitation. The International Wildlife Rehabilitation Council given a definition for the wildlife rehabilitation: the treatment and temporary care of injured, sick, diseased, and displaced indigenous animals, and subsequent release of healthy animals to the appropriate habitat in the wild. So this is the definition for rehabilitation. So this is basically what we do. So all the rehabilitation process start with the rescue. So one thing to keep in mind is that a rescuer is not the owner of the bird. So most of the people have a notion that if you see a bird and keep it, you are the owner. But actually, it's not the case. If you get a bird that it's belong to the state wildlife department, it comes under schedule 1 or 4, whatever it is. It's belong to the state. You can't be the owner. So the people who are involved in this rehabilitation process is known as rehabilitators, and you should actually need a license to be a rehabilitator, to rescue and release the wild birds into their natural habitat. So this actually this system is a little bit disorganized in India, but still it works. It's a combined effort of a veterinarian and a rescuer. So and there are I just have to say that there are more than 10,000 species of birds in the world, more than 10,000, and entire every one of them are different. Every one of them participate in a different, belong to a different niche. You know this thing, and India comes in the 8th place uh, in the species count. In India, it's been reported that 1,348 species has been reported from India alone. So Colombia is the first, I believe, in species diversity. If you want more details, you can check the eBird website. It's a very good website. It's a collective data of entire birders around the world. So it's very interesting. If you have, if you can make an account or something like that in that. So it is very interesting. There are more than 1,348 species reported till now from India. And the latest addition was a winchat. It's a very small bird from Tripur. They found it recently in the last December or something. So, so after getting a bird in your hand, identification of that bird is very important. Then only you can proceed with the feeding, the management, whatever it is. So identification, my special expertise in only in this area actually. Identification of the species. Sometimes it is very difficult to identify. Sometimes it will be very chick. All the chicks looks the same, you know that. And so identification is the key. Is the first step you have to do after getting a bird in your hand. You can consult a local bird expert, or you can get it to a vet. Somehow he will give you the ID of the bird. Mm. And second thing is the determining the age of that bird. We call them, it's basically divided into three: nestling, fledgling, and an adult. If you are getting a nestling, it is very difficult, and the management is difficult. They need constant care. If you are getting a nestling, best thing that you can do is put a pair of gloves and put it back into the cage. So the mother bird will take care of it. Otherwise, if you are taking care of it, it is going to be very difficult. I just have to tell you this first. So put a pair of gloves and put it back to the nest. You can find the nest somewhere in the vicinity. So if you can't find the nest, you can keep it in your hand, and you can. Next stage is fledgling. Fledgling are the young birds who are just learning to fly. Sometimes you can get them in your balcony, some on the terrace roof. When they are learning to fly, they are very what to say, vulnerable, and sometimes the cat or dog will chase, and you are possibly you will get a fledgling sometime. And the adult, if you are getting an adult, it means that there is something wrong with the adult, either a low glucose level or some disease or fracture, something will be there. Okay. So like I told you first, that identification of the young bird can be quite a bit of challenge at the first time. And the first bird on the top, you can see that hairy chick in this hand is actually a greater cowgirl. It's a cockle chick. It may not look like an adult, but mm, only only an expert can tell it if it's an adult. No, so the species actually. So it's a greater cockle chick. What is Hindi? In Hindi, I think it's called a mahok or something like that. The one on the left or the bottom is a snipe, painted snipe chick, and it more or less look like the adult. No problem on identifying this thing. And the third one is a nightjar chick, and the fourth one is a raptor chick. So it's pretty difficult to identify which species it is, but from the plumage itself, you can tell it's a raptor chick, because most of the raptor chick, whether it's a buzzard or a vulture, whatever it is, most of the time their young ones will be white in color. Young ones will be white in color. This downy feathers will be super white and fluffy. So from that you can tell. Else you can, what you can do is to check the beak shape. So you can see here that curved beak represents a raptor beak, and this one in the left, the long beak, it must be a wader. Wader means water birds which are wading in the mud, and insectivorous. They are mainly insectivorous or like piscivorous, some kind of birds like that. And the one in the middle, that's nightjar chick. This nightjar chick and the swift leg all are insectivorous. So your feeding should be matched with that, with the adult pattern. Whatever adult are feeding, you have to give the same. So we'll come to the feeding later. And One sec. So predisposing factors for getting a bird in your hand. So there should be some problem. One is environmental. Either it will be very hot or very cold climate. In hot summers and everything, you will get a kite or vulture or something like that in your hand. They'll be hyperthermic. They'll be flying for a long time. They won't have any glucose in their blood. So the management differs. And if the climate is hot, the bird will be hyperthermic, and the climate is cold, the bird will be hypothermic. You need to give it some warmth like that. And sometime storms in the coastal areas, you used to get a lot of terns, gulls, skuas and everything due to storms, because when the strong storms hit the coastal area, these deep pelagic birds will be driven into the coast, and they will be flying for a long time, and they will fall down eventually, and somebody will pick up and give it to you in the clinic. So usually after a very windy day, we used to get a lot of terns, gulls and everything in our clinic. Then toxicity. Recently in Rajasthan, there has been an algal bloom poisoning. It's actually it's a cyanobacterial. If they are flourishing in that stagnant water, if the birds are eating that bacteria containing water and insects, they will get that poison. And avian botulism is another cause. So due to toxicity also, you could get a bird in your hand. Some predators, dogs, the cats and dogs will chase that some birds, and probably you will get this a lot in your clinic. And diseases, sometimes you used to get this. Some pigeons are very prone to this pox. Sometimes they will get this pock lesion around their eyes. They will get trichomoniasis. So eventually they will fall down of the nest, and somebody will pick it up and bring it to you. So these are the main predisposing factors that you used to get. So some rules and regulations. Like most of the birds are protected under Wildlife Protection Act in 1972. Many endangered species comes under Schedule 1 Part 3. This one you have to remember. Schedule 1 Part 3. In this you can see our peacock, great Indian bustard, so many everything. Many common birds you can see in Schedule 4. If you are keeping a Schedule 4 bird, it may not be a problem. But a schedule, am I audible? It's showing something else here.
Yes, we can hear you. We can hear you, Adhithyan.
Okay. So, and one bird comes under Schedule 5 crow. And I think in the next coming years, our pigeons and miners will come under crows 5. Schedule 5 is actually comes under is a group for vermins. So I think most of the time they will come. Soon they are going to be in this Schedule 5 list. If you get the Schedule 1 bird in your hand, you have 24 to inform to the State Forest Department. So this is an easily downloadable document from your Google. You can easily download this from wherever it is. So it shows which schedule it belongs. If it's a Schedule 1, you have to immediately report it to Forest Department. Otherwise, I think there is no harm in keeping it, but eventually you have to release it into the wild. So, and the rule is different for native and non-native species. Non-native species means the migratory species. And basic ethics behind this, the ultimate goal is always return into the wild. Any wild bird, whatever you are handling, ultimate goal is always return into the wild. Where they are in their natural habitat, whatever you give, it may not be sufficient. So better to return it into the wild. That is what it is. Treat them with the dignity in Uh, no, and the fourth point is a little bit controversial. Non-releasable animal have a right to euthanasia. So in our place, they are not practicing euthanasia so often. And if the bird can't sit upright after a initial treatment or something like that, that bird have a right for euthanasia. And if a limb has been cut above a toe level, that bird also a candidate for a euthanasia actually. And severe injury, amputation of the wing. So these birds, whichever birds that can't survive in the wild, even after treatment, uh, it's a matter of fact that you have to euthanize the animal. And blindness is very common because in the eye there is a structure called a specten, and whenever the animal get a head trauma or something, this pecten will break, and the eyeball will be filled with the blood, and they can't see after that. So blindness is a irreversible blindness is a candidate for this euthanasia. And if that condition can't be treated more in 180 days, 180 days, almost 6 months. So if a bird with a fracture, we can heal it within like 50 days. But the condition is irreversible, like if it is more than, if it takes more than 180 days, these animals are also a candidate for euthanasia. Then possible causes of injury that you know already. Attaching string injury, we used to get a lot of this in that Manja festival in Jaipur and everything. Recently, we have conducted a survey, not sorry, a treatment camp in Jaipur after this festival, and we got 50-55 birds per day because of this kite string injury. And stuck on windows, it's usually common in developed countries because of the big skyscrapers and the light, and so most of the time the migratory birds will hit on the windows. And I'm not saying that it's not very common, but it is very common in European and US countries. Fallen out of the nest, attacked by predators, or in this case, escaped pet. These are the common scenarios that we used to get. Then we'll come to restraining, handling, and restraining. Just as I told before, a nestling, if you are getting a nestling, just replace back in the nest with a pair of gloves. It's not for the smell, because there is a old saying that if you are touching a bird, it will get that human smell, and the mother won't take it. It's not like that. It won't work like that. Actually, the birds are very poor sense of smell. They can't smell it very much. If you are putting it back, even with the human smell, it won't mind. So it's for some parasite and some diseases that could spread from chicks to human. So that's why I told you to wear some gloves. And minimum handling. This is very important because handling a bird, it will cause a tremendous amount of stress on the animal. So minimum the handling, better it is. So just wrap it with a towel and put it in a hard box, put some holes, and keep that box in a corner, warm dark area. So it will be fine. That stress level will be half. So that is the best thing you can do. And the ultimate aim is maximum safety for the animal and the handler. That is the ultimate thing that you have to focus. There are no science, or there is no specific technique or nothing like that, but this is common sense. It has to be maximum safety to the animal and the handler, and minimum stress. And there is a 5-minute rule. It's actually in Canadian medicine, a 5-minute rule is there. So if you are handling a bird, you can't handle it more than 5 minutes. So that is the thing. So if whatever you are doing, if you are giving a medication feed, trying to feed the bird, if you are putting from one cage to another. You can't handle it more than 2 minutes. For wild birds, you can take it as 2 minutes. More, not do not handle a bird more than 2 minutes. And humaneness of the procedure, whatever the procedure is, whatever the procedure that you are doing, it should be humane. So basically, there are different technique for different sized bird, and the first one is for the very small sized birds, very small sized passerine. It's called a ringless grasp. Uh, so basically, what you're doing is to hold the neck in between your index and middle finger, so that it can't uh, uh, it can't move his head. The entire in your hand. So and you can do whatever you want it to the bird after this. So you don't have to worry about if you choke the bird, because the trachea of the bird, the windpipe, is actually very rigid in birds. So you don't have to worry about that. In majority of the other animal, that wingpipe is like C shape. If you press it, it will go like that and it will like collapse. So for a bird, it's not a problem. For you most likely have seen the ducks and everything. You can hold it by the neck. It won't be a problem. So trachea is rigid. You don't have to worry about choking the bird. And so basically the same thing. And this is for handling swan or this sized bird. You can put it in the other way, this the head should. This is for the maximum safety of the handler and the bird. And you can. This is not actually. He's not sitting on the bird. Like you can restrain from the sides. He's not actually sitting, and restrain the body and the neck. So same thing here. This is a crane. The same method, you can use it for a crane, long-legged birds, because beaks are super sharp. So whatever it is trying to do, it might get it right, and it will be a big problem. And for raptors, this going to be little bit of challenging. If it's a big raptor, it's going to be little bit difficult because they are powerful birds. The most dangerous weapon they have is the talons. That talons mean that legs and claws. This is the most dangerous part. You don't have to be the reader. They won't. Uh, this you have to be very careful about, not the beak. And I'm audible, right, Anisha?
Yes, we can hear you.
Okay, fine. So the method is known as casting, and this is how you used to this is how you want to hold the bird. If it's a big bird, you hold its talons by its thigh, and you just press the wing from the sides, and one person can put a hood over put a towel over his head, and it's actually a two-person handling, or two or one-person handling. So any bird, if you are handling, just keep it in mind. If you are covering its eye, it will become very obedient. It is like a magic, actually. If you are covering its eye, it will make the procedure very easy. So if you don't find anything to put, just put some socks. They will sometime people used to cut the tip of the sock and they will just put it over the head. Something will work. You just have to. It's like an ostrich. Just cover its eye and it will be done. So that's about birds of prey. Mm, some basic triage for emergencies. Triage is nothing but to determine an animal whether it's an emergency or not. The severe hemorrhage, recumbent animal, showing any respiratory difficulty, seizures, or everything, or these kind of birds require an immediate medical attention, and observe their mentation, posture. If you are hardcore veterinary subject, I'm just skipping through it. Then stress, just like I told you, the stress is the most important part. You have to try to minimize it as much as possible, because the stress will kill the bird eventually. So the stress is a very difficult part while doing an avian species examination. So if they are getting stressed, they will go into the shock. You go into shock, and they will eventually they will die. So try to minimize the stress as much as possible. So even if you are getting a bird in your hand, presume the stress is present. So it will be there because it was a free wild animal. Someday it will fall down, and you are handling it. Whatever it is, you are a predator for that bird. So it will be in tremendous stress, and people shouting everything. It will push it to stress and shock to the bird. So as much as possible, handle it minimum, and keep it in a cold, warm, sorry, warm, dark area. If you can keep that bird in a warm, dark area in a cardboard box, it will be fine. Uh, and signs of stress is actually open mouth breathing. Sometime you can see that bird with open mouth breathing, just like this. This animal is in tremendous stress. Increased heart rate, increased temperature and regurgitation. Heart rate is actually very high in birds, so it will go even further if you are handling the bird or just by shouting. Increased temperature. Normal temperature of a bird range between 39 and 44. It will go up again if you are like making stress again. And regurgitation, it is very common in raptors and owls. They will regurgitate the food after getting stressed. So there are like some fundamental goals for rehabilitation. These will go through each one by one. So first one is to reduce the stress. I can't stress this point enough, but this is a big deal actually. If you can reduce the stress by 50%, you can increase the survival rate up to like 20-25% like that. And if you are keeping a bird stress free, it will heal better. Everything. Basically, you have to keep the stress in a minimum reduced level. So keep it in a warm, dark area undisturbed for 15 to 30 minutes. Whatever you are going to do, like if you are transporting a bird from one place to another, so keep it in a box and keep it in a core dark area for like 15 to 30 minutes. It will make a huge change. The bird will become calm. And visual barriers. You can't transport a wild bird in a that pet bird cage. So better to take it in a if you have only that cage, just cover it from the whole side with a blanket or towel or something like that. Okay, and away from other animals, like this is it's a very weird scenario from in, when you are bringing a bird from anywhere it is. So they will be bringing directly into the clinic, so there'll be cats, dog barking. So this is a very stressful environment for a bird. So uh, better not to go like keep it in a box and you know. Okay, okay, just like I told, handle as less little as possible. And appropriate substrate means that substance, that bedding material, whatever you are putting in the cage, it should be a paper, a towel, whatever you can put. It will be necessary. It is necessary actually. You can't put a bird in a excuse me, Anisha,
Yes, Adityan.
can you hear me? Is there any problem?
Yeah, I can hear you. I can hear you just fine.
Can I continue?
Of course, of course.
Okay, okay, okay. How many time I have left? How much time?
About 30 minutes. No problem. You can continue.
Okay, 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 okay. So appropriate substrate. So this is the bedding material, or you can put a simply put a paper or towel, something like that. It will make a big difference, especially for deep pelagic birds. You have to give a substrate. You have to give a soft bedding material. The under parts, like the breast and keel bones, are very sensitive. If you are putting it in a regular pet cage without any perch, it is going to destroy their feather on the lower head. It will tear the skin. So better to put a paper, at least a towel, in that cage. And there are some rescue remedies. Some, I think it's some essential oils. It will help with the stress. Actually, it will reduce the stress. I have seen people using it, and they are recommending that it is really good. I haven't tried this myself. And if it's an alcohol preparation, just dilute it and give. I don't find any harm in giving this thing. Okay, rescue remedy is the name. Okay, and the correction of hyperthermia or hypothermia. So if you are getting a bird in a very cold season, it will be hypothermic. The temperature will go below this 39 level. If you are getting a bird in a summer temperature, probably the temperature will be more than this. So what you want to do is to maintain this that body temperature in between this range, 39 to 44. 40 will be the ideal range. So as a cold bird, you just touch it and feel it. The cold bird will be fluffed up in appearance. Sometime it will be wet. So you can use a regular incandescent bulb, IR bulb, or even this a hair dryer you can use. But don't put too much pressure. Uh, you can use that. And this one on the top is avian ICU. It will regulate temperature between like 60 and temperature like this 37 to 40. And this is called as the avian ICU. I don't think we have this in our clinic. I've seen this in some advanced clinics and pet shops. And another one is warm hands. And this is basically just a glove filled with the warm water. And if you are getting a chick, what you can do is fill a glove with the warm water. Warm water means like 37, 40 degrees Celsius water you can fill in the gloves, and 2 or 3 gloves you can like put it in a line and just cover it with the towel and put the bird on the top. It will make a big difference. And heating pad, actually you can I've seen this using for reptiles. And while you are using it, just make sure that you have to check the temperature more often, because sometimes this thing will overheat and it will burn eh, like bottom to top. If you are putting a chick on it and putting on a heating pad, try to keep it in the lowest setting, and always have an eye on the temperature range. Okay. And space heaters and room heaters, these are like can be used in a sanctuary or something like that, or in a room. And you can just the minimum distance should be like 1.5 feet minimum distance. So you can just give the bird a space to roam around. It's basically like brooding of chicks. And hyperthermia is increased body temperature in this summer. And basically you will get kites and vultures like this. The vultures will fly a lot in the summer sun, and their their blood glucose will go way down, and they will fall down eventually. So their temperature also will be very high. So what you can do is if you are getting a bird like that in summer, what you can do is spray some water, on the very cold water, spray some water on the beak or legs. So this will cool the bird really well. So the best places are beak and that talons and thigh. So if you can do this, it'd be really good to bring the temperature into the normal range. Uh, this is some veterinary stuff. These are some fluid administration. And if the bird is very lethargic and you can't give the water, you can give a subcutaneous route. Under the skin, you can give the water. This area is called the precrural fold, where the thigh joins the body. There you can see a small flap of skin. There you can give a very little amount of fluid twice a day if the bird is very lethargic. So or the bird is drinking, this is a good choice. This is a pediatric or electrolyte combination from Abbott. This found to be really good Pedialyte for chicks and adult birds. Uh, Better than giving water. If you are giving this will make a big difference. And initial diets, before getting into the diet and everything, I just have to tell you that in naturally, in wild, the survival rate is very low for a bird, for an wild bird, only 30 to 40%. It's like one in three, it will die. So don't feel bad if the one of the chick that you are looking after is dies. It's quite natural. So this has been an old study. I remember, it's a very old one. So this is their normal natural survival rate. So first thing is correct the temperature and hydration status. Just I told you, hypothermia, correct hypothermia, and hydration status. Give the fluids. Even if you are getting a chick, like presume there is 10% of water loss from the body, and hydrate that fluid administration should be according to that water loss hydration. And you have to give the water till the point where the droppings are produced. And there are two types of chick: altricial and preconcial. Altricial chicks are very fragile, independent, like very dependent on their parent, like most of the passerine birds, like bulbuls, parrots, and everything. So they need a constant parent care up to up to a level of their life. And precocial chicks, like ground nesting birds, like ducks and everything. So precocial chicks are very easy to handle. If you are getting a precocial chick, then you will understand. Snipes, this ducks and chicks, peafowls and everything are precocial. So they will eat their own. They are born with their eyes open, so there won't be much of difficulty in looking after them. Then age, as I told, there are basically three: nestling, fledgling, and adult. Okay. So and this is also a veterinary subject. If you don't have any, this is the ideal fluid of choice for the subcutaneous administration: 1:1 combination of DNS and ringer lactate. Just to keep it in mind. So the fluid rate is 50 ml per kg subcutaneously. Fluid rate is quite high in birds. So this is the rate at which you have to give. So a 100-gram bird only require 5 ml of fluid. So that's it. Okay. So feeding of bird, most of the question comes from this section only. So what to feed for a bird? So there are basically these are the best choice. and Nutribird A19, A21, exact. These are baby bird food formulas that you have to mix it in warm water, make it into a paste, and feed the bird. So if you can get your hands on this, this will be the excellent choice. Actually, this is very expensive, like $1,200 for like 300 grams. So if you are willing to willing to dedicate that much, this will be a better choice. This contains whatever protein they need, minerals they need, omega-3 fatty acid, whatever they need. These these are like the international brands. So so they have formulated according to that the each species requirement. So so if you are getting a chick, if the eyes are closed, this that bird is probably less than 1 to 2 weeks of age. So if the they usually open their eyes. This actually this differ a lot between birds and different species, but this is basically the thumb rule. After 2 weeks, they will just start opening their eyes, and they will gape for the food. It will be very easy to feed them at that point of time. In for a chick, the usual feeding interval is about 30 to 60 minutes. That means you have to keep feeding it once in every 30 minutes. That is a natural feeding interval given by the parent. So once the one bird is fed, the parent will go after. That is the like average feeding interval. So these things, these feeding formulas can be used for pigeons and parakeets and budgies. And for raptors, if you are getting any Brahminic-eyed, black-eyed chick, so best thing you can give is beef or chicken meat slices, uh, and like egg. This egg you can give, egg paste you can give. So that meat, whatever you are giving, if it is red in color, it well and good. They will take it very nicely. That red color should be there. So in zoos and everything, they give day-old chicks for raptor chicks. That may not be possible in our condition. So give chicken slices. So just before giving chicken slices, dip it in a DNS or some glucose water or something like that, so that they can get some glucose also. And egg is a good choice. Just a boiled egg, blend it into a paste. And Hill's AD diet is actually a pet diet for geriatric dogs. It's easily digestible meat supplement that you can use if you are eating this in your hand. This is also a good choice. And precocial chicks, previously I told you, like peacock chicks and everything. Ducks, you can use mealworms. Mealworms are excellent choice for these precocial chicks. And you chop it into pieces and just feed them like this, and this works really well. And that earthworms, I heard they are not a good recommended thing, but the mealworms are really good. So if you can't get any of this, so just give this formula. So this is basically 60% puppy food. Any dog food will work, no problem. And 20% boiled egg, 20% mealworms. If you don't get mealworms, it's okay. You can use like 60-40, like 60% puppy food and boiled egg white, blend it into a paste and feed the bird. That will work just fine. Okay. And if you can't get any of this, you can use breadcrumbs. Even if you are not getting puppy food, like breadcrumbs, you can use this boiled egg. Just mix the egg white and the yolk. It's fine. And if you are getting three of this it will work for almost all the chicks. So thing is, even the adult bird is like vegetarian, like frugivorous, like doves and everything. their young ones might require protein. So you can give this in their even the bird is nectar feeders like a sunbird or something like that. The adult will mainly feed on nectar. It doesn't mean that their young ones will eat anything else. So you can go for this formula. So so if you are getting an adult bird, just check it with a bird expert what is their natural diet, or you can, if you are getting the correct idea of the bird is that their natural diet, you can get it from Wikipedia. Just collect it and blend it into a paste, whatever it is, fruits, vegetables, egg, fish, anything you can blend into a paste and you can feed. It's just fine. Okay. In feeding, I am not going very deep into it because sometime you can use this plastic feeding tube, sometime you can use this metal. So if you are feeding this force feeding actually, so if a bird is not eating properly, so you can force feed. Hmm? I hope it is clear. So this for a raptor or a parrot with a very strong beak, you might have to use this stainless steel crop needles. And if the bird is like a budgie or a dove or something like that, you can use a plastic feeding tube. If you are not getting a plastic feeding tube, you can use just a butterfly catheter from your hospital. So So just make sure that uh, after every feeding, just check their crop if it is empty or not. So the first time you feed, it will the crop will be emptied like within half an hour, and if it will take maximum to 4 hours. So just make sure that before the second feeding, just make sure that the crop is empty. Then only you push the other dose. You might have to do this for an adult bird once or twice in a day. We'll just give you a chart for the feeding frequency, and this is how you crop feed a bird. It's again a veterinary subject. So there are like clamps to keep the mouth open for a very small bird. So this is how you do it. When they open their when they open their mouth, that windpipe will be, the opening of the windpipe will be very small. I will show you another slide. The opening of a windpipe is very small. This is quite easy to get into that esophagus. So this is just like this. Go from this left side to the right side, like this, and make sure it's the crop will be in front of the thoracic inlet. Again, and the crop volume will be for a bird weighing 1 kilogram, it will be around 50 ml. So why I'm telling this is if you are getting a bird of 1 kg, so you can fill it crop up to maximum up to 50 ml. If you are getting a bird for 100 gram, you can fill 5 ml, but don't fill 5 ml at once. Like if you are getting a 100 gram parakeet, make that feeding formula and give 1% at once. After half an hour, just check the crop. If it has emptied, give that next 2.5%, then give the 5%. Don't give the entire 5% at one go. That is the only thing that you have to remember. This is what I told you. So if you want to force feed a bird, if you open their mouth, there will be like 3 openings. One opening is one very small opening is on the base of the tongue. It goes to the trachea, and the big one is the esophagus. The third one goes to actually the nasal cavity, so you don't have to worry. So this is our area of interest. So you have to put the feeding tube here. Very rarely you will miss this. It's very big. So this is where you have to put it. So this is the feeding chart, and the there are different needle sizes actually, not very important, I guess. As the gauge goes down, that size will go up. So I'll show you. So this is like a 16 or 18 gauge. This is 8 to 10, just like a needle that you are using in a clinic. Okay. So I just want to point something about the housing. So you can use a temporary, this basically temporary housing. Uh, you can use a hardboard box with a paper as a substrate. You can use cat carriers with a perch inside, and modified aquariums. You can use tubs or different sizes. You can use visual barriers. I always try to remember, if you're carrying the bird in a pet cage, you just put a towel around it so that it won't see the surrounding. It will itself calm the burn down. And soft towels. And just remember, any bird require a sunlight minimum of half an hour. You can give it half an hour morning and evening, or half an hour straight. If you are building a house or aviary, just make sure that some part get the sunlight at least half an hour a day. Oh, like this. This is the cat carrier. And this one is for rehabilitators. This imprinting is a very big problem during this rehabilitation process. Imprinting is nothing but, if you are taking care of a bird, it will get imprinted. It will think that you are the parent. It will goes to human for food. It can't survive its own in the wild. So it is going to be a tough, quite a bit of challenging. So imprinting is actually a problem in our place. Any rescue or rehabilitation processes that takes more than 14 days, it has a risk of imprinting. If you are taking care of a duck, you can see in this picture. This is actually very much problem with the precocial chick, because they are born with their eyes open. So if you are feeding it, they will think that this is that is your parent, that is their parent, and they will just follow you everywhere. So any rehabilitation procedure that takes more than 14 days will have a chance of imprinting. So there are some ways to prevent this imprinting, is that not to show human face. That is the basic thing. So that bird should think that it is getting food from from an adult bird. It should think like that. This is from a vulture rehabilitation facility. They have did a great job making a head of a adult vulture here. You can see, and the baby will think that that is their mother. And these are called the puppets, and they're basically toys that you can put your hands in. And basically the only thing is you can't show your face, and the bird should think that it is fed by its mother, or something just looks like it in the. And you can use a rope. It's not possible. I think it's used in foreign countries, this robots and everything. And costumes are there. These are called puppets. This hand wearing, we used to wear on the hand. And at least the least thing you can do is to cover the face. The bird should not get imprinted on humans. That is the basic thing. And you can use playbacks, like while feeding the bird, you can give the audio playback of the adult. You can keep some mirror on the sides of the, so that it will think that it has some company, like that. So this is a small slide for whoever are trying to rescue a bird. And so these are some first aid tips. So wounds, So what do you want to, if what are you going to do if you are finding a wounded bird? So don't put haldi. That is, I'm not against haldi, because sometimes it is very difficult to wash it off if you are getting near and stuff. So wash it with the plain water, and betadine or silver ointment will be fine. And just washing it with the plain water will be fine. And hemorrhages means bleeding. Sometime that, wait for 5 minutes. Don't, if you are finding a bleeding bird, wait for 5 minutes. It will stop on its own. It has a inborn clotting mechanism. It will clot its own. But if that bleeding is very severe, just give a firm pressure for 1 to 2 minutes after, like taking the bird in your hand. It will be more than sufficient. Use a cotton ball and just press the wound for like 1 to 2 minutes straight. So this will do the trick most of the time. And for birds, actually, the blood loss threshold is quite high. You know, the birds have much more blood than any other animal. Like it will vary according to species. Some the partridges and the ground bird, they will have like 5% of their body weight in blood. Humans and other animals, around 5.5 to 7% of body weight in will be their blood. In the birds, it's quite high. It will go up to 20 ml and 20 percentage of body weight. Like if a racing pigeon weighing around like 100 gram, it will have a 20%, 20 ml of blood. That is quite a bit of quite high according to that size of the animal. So they can uh, withstand a serious blood loss. They will recover, not a problem. And fracture, what you are going to do if you are getting a fracture? But one thing you can do is to cover it with a the best thing you can do is to cover it with a towel and keep it in a very small confined area. That is the best thing you can do, and consult a vet. And there are some wing bandages. I'll show you some pictures, and you definitely you can try this. uh, but after getting a fracture and everything, if the bone comes out and if it's been a quite bit of time, the chances of healing is very less. Once it comes in contact with the air, and the edges, that cells will die. And you know uh, when it's called as open fracture, it won't we use most of the case, you might have to amputate that part. So best thing you can do is to wrap it in uh, in a towel and keep it in a very confined small area, and consult a vet. And broken blood feather. This is nothing but an immature feather. Sometime it will hit somewhere and bleed. This is actually seen in pet birds, but you can also see in that fledgling. So one thing you should not do is, if the blood feather is bleeding, don't pull it out. You can twist it with two artery forceps. Again, it's hardcore veterinary topic. I don't know how to discuss. So just don't consult a vet as soon as possible. Neurological signs. This could be neurological signs, whatever. If you are getting a bird with this nervous signs, what you have to do? You just keep it in a dark box, that till the bird settles down. That will be good. It's maybe due to rodenticide toxicity. The bird might have eaten a rodent after eating that rodenticide toxin. So it will cause some neurological sign, OP, OC, organophosphate, organochloride poisoning, toxicity. Anything can cause neurological signs. So this is a raptor with a wing bandage. It's actually it's a Bonelli. We did a wing fracture, and this one is called the tail sheath. So while flying, this tail feathers are very important. It should not get something like that. So it's better to put a tail sheath if you are handling a raptor. So the release is the best part in the rescue. So if the if the rehabilitation is successful and the bird is healthy, you can release the bird into the wild. There are some criteria before releasing, so just have to check it out. So one thing is that medical, there should not be any injuries. Physically, it should be fit to hunt and if a good feather condition, normal body, and everything. Basically, it should be ready to survive in the wild. That is the basic underlines. Psychological will just before releasing, there is something called as soft release. Actually, just before releasing, release into a small open area like a aviary house or something like that. So, after that, you will come to know if there is any problem. Just go near the bird. If it is flying away, it's perfect, and you can release into the actual wild. So, and let me finish up with some important thing before uh, finishing this seminar. You have to be cautious about some possible zoonosis. Zoonosis are the diseases that can be transmitted from humans to animals and animals to humans. So these are some diseases that you have to be worried, that you have to be cautious about. Chlamydiosis, this is an upper respiratory tract in human beings. It can you can get this infection from a parrot, a pigeon, barn owl, these kind of birds. So if you are getting a fever, sneezing or something like that after handling any of these species, mainly in parakeets, it's mainly this reservoir species is parakeets. So it's very high chance to you will get this. So then another one is avian tuberculosis. This is also you can get this infection from kites, owls, and crows, etc. And this is a fecal-oral route of contamination. If you are not washing your hands properly after dealing with any of the species, you can get this Mycobacterium Avm infection. And this won't cause many very severe disease. It will cause local wound in swelling, wound infections, and lymphadenitis in humans. Avian influenza, basically, you don't have to be too much worried about this avian influenza because there is a very less chance to spread from a wild bird to human. It's actually spread from wild bird to our poultry population. So I am not saying that this is a silly infection. This is very deadly. If you are getting an avian influenza, it is with mortality is around 60%, not like our COVID. So, so this is very serious infection, but the chances of getting it are very quite low. Okay, and there is Cryptococcuses and Histoplasmosis. This is basically comes from these are actually fungal infections. It can cause severe meningitis. Basically comes from pigeon droppings. If you are living a place where there so many pigeons are there, or if you are handling pigeons too much, chances of getting these infections are quite high. These Cryptococcuses and Histoplasmosis. And salmonellosis and Campylobacteriosis are another GI gastrointestinal tract infection that you could get after handling a wild bird. So wild birds can harbor these bacteria, and while handling, you could get into your system and it can cause a disease. Basically, it is GI infections. It will go off like in 2-3 days. It's not that very severe. Another cryptosporidiosis is also another disease that you could get from a bird. So I'm not discouraging you, but you have to be cautious about these possible zoonosis through birds. That's all. These are from our recent bird camp from Jaipur. As I told you, there has been like 50-55 birds that we have treated during this period of time. Okay. Thank you. I hope this session was useful for any of you guys. So I'm handing over my session to Anisha for any Q&A, any questions, anything. If there is, you can just ask. Okay,
Thank you.
Anisha, you can take over now.
Thank you, Adhithyan. Yeah, you definitely have a lot of questions that have come along the course of this session. I think if we,
Oh my God.
I think the session was supposed to be an hour. We've obviously increased on time a little bit, but that's all right. If we are not able to answer your questions, we can always just get back to you on email. But for now, I think we can take at least about 4 or 5 questions.
Yeah, sure.
All right. So I think the first question I
Yeah,
think
sure.
that's been there for a while is are pox and RD diseases curable?
Oaks and Ranicate disease. Actually, those are viral diseases, and viral diseases they will resolve their own. We don't have a specific cure or anything like that, but either the there is a thing with the viral infection. If a virus get into your body, either the virus will die or you will die. That is the thing. So it is
Mm,
like that. If there is a pox infection or something like that, it will usually it will cure on its own. There's nothing to worry about. There are some homeopathic preparations, some antiviral drug that has seen to be effective, but in my experience it will take a quite a bit of time to heal.
mm, mm. Um,
So there
okay.
is no perfect antiviral also for those
Mm,
infections.
right. Um,
Okay.
all right. So moving on to the next
Anything
one.
else?
Why, in the case of hyperthermia, should we wet only conscious birds? Why not unconscious ones?
So the thing is, if you are wetting a bird,
We're not able to hear you, Adityan. Hello? We can't hear you.
yeah, yeah. Now,
Hello?
hello, can you hear me?
Yes, yes. I think you can.
Hello, I can hear you now.
Hello? I think Adityan's been disconnected. 1 second. Yeah, he's back. Yeah, Adityan. I think you're on mute. If you can just unmute yourself, you could answer.
You, uh, see here that cavity and the trachea, esophagus, all are interconnected. So if you are waiting a bird, in water will go through the nose. This is the nose, nasal cavity. The water will come through here, and sometime it will go to the trachea. That's right. That's to wet the bird if it is unconscious.
Hmm. Hmm. Okay.
Hence, it will get into the trachea and it will choke. Okay.
Hmm.
Anything else?
So we have another question. A couple of more questions. What must a BSc zoology studying student pursue in the masters to get into the wildlife field? Are there 2 or 3 options available?
I think there are two. Yeah, yeah. There is MS Wildlife.
Mm-hmm.
Basically, from Kerala, there is one college and one course from there. And
Mm-hmm.
there is a, I think there is an MS Wildlife course in Kerala.
Mm-hmm. Right. Um, okay, we'll take I think 2 more questions and then we can answer the rest of the questions on email, I believe. Okay, another question I think is an
Yeah, sure.
interesting one is there a different technique for feeding birds, feeding species of birds which don't have a crop?
um, species that don't have a crop, I believe those are vultures. And I don't think there is a different technique, but you can basically give the basic same food into that stomach and it will get digest. There is no much issues. But bird have don't doesn't have the crop. I think that feeding interval will be much more like constricted. That's all. That is only the thing.
Hmm. All right.
I don't think there is much more grow.
Okay. Okay. Okay, we have another question is most people keep ring-necked and Alexandrine parakeets as pets in India, which is not legal. If someone wants to release these birds, where do we release it?
That's a good question. So basically, these are wild birds, and you are not supposed to keep them in hand.
Hmm. Hmm.
So I've seen a couple of Alexandrian parakeets along the flock of this our ring-necked parakeets. If you can release in a place where these flocks comes, I think there is a better survivability rate for these kind of parrots.
Mm-hmm.
Even if a hand raised parrot goes into the wild, they will like those are what to say, those birds are actually social birds. Like they will form a small group and they will like hunt together, like live together. So I think if you can release such a birds in treatment of ectoparasites. Okay, so I think if we can release such a birds in near those colonies and something like that, there is a better chance of survival.
Hmm.
Not in the wild, like alone.
Right. Right. Um, okay, we have another one. What do you do in the case of ectoparasites? How, yeah, that is in the case of
For
birds, yeah.
ectoparasite, yeah, okay. So there we have a couple of options that you can. There are some ectoparasiticide, fipronil, some whatever used in uh, pet dogs and cats. You can just dilute it and pour on the top of that bird. Fipronil, I think that is the best thing that you can do. Fipronil is there, and for some chicken, substrate and some potent in ectoparasiticides are there, but they are very potent. You have to dilute it as the bottle says, and just dip the parrot and just keep it in sunlight to get dry. So basically, same thing as a wild bird. So you don't have to.
Hello?
Got interrupted.
Yeah.
Hello, can you hear me?
Yeah, yeah, we can hear you now.
Yeah, okay. So basically, some level of parasitism will be there in any wild species, whatever it is, a mammal or a bird. But if it is too much, you can use this. But otherwise, some parasite, it may not do much harm, I
Mm,
believe.
okay. There's another question about do you have any instructions for hatching eggs?
Hmm. Hatching egg of a wild bird in captivity.
I suppose. Or not
Basically,
ideal,
I
of
don't
course.
think we are allowed to do that.
Yeah. Mm,
Okay, anyway, there are some portable incubators if you must have to use. There are some very nice incubators for pet birds and everything. They will keep the temperature for like 37, 38 degrees Celsius for
mhm,
like 20, 21 days.
mm,
So
mm.
I think it will work. that pet incubator, same thing you can use in wild also,
Mhm.
but I don't think that we can do this.
Mm. All right, so we'll take one more question, and I think we'll end the
Okay.
session then.
Okay.
Is there any further sources or further reading you would recommend the people listening to you today, especially related to birds and veterinary medicine? Anything you feel is relevant on this subject matter for the audience?
Okay. So for the where is it? So there is a website called as Lefever Vet. So this is basically for exotic pets and wild animals. So they have wonderful content in this website. You have to get an account, just register your name, and after that you can get a lot of content. There are pretty interesting content: how to feed a bird, how to every management aspect, any exotic bird or reptile, everything, whatever it is, they have the very nicely prepared videos and contents, and everything is there. And for reading, I would one book, why Zoo and Wildlife my Management by Muller, Muller and Fowler. There was, what was that book name? I forgot to add in the back.
Fowler, yes.
Uh, okay, so I think that is the best.
So, all right, I think
Uh,
uh,
okay,
we've been able to answer most of the
so
questions. Any last words, Adityan,
okay,
from you?
okay. Thank you for a wonderful opportunity to present all these things. So it's been an honor. Thank you, Nisha.
Mhm.
I
Thank you,
hope I
Adityan.
hope I helped somebody. Like,
Absolutely. I think we're all
okay,
going back as
okay.
experts, even for bird rehabs. And I'm sure people will have more questions. If you could just open up your last screen so that people can note down your email ID, we can then end the session as well. I think if
Yeah.
all of you do want to ask Adityan more questions about his experience with wildlife as a wildlife vet, you can definitely write to him as well. And and I would like to say again, thank you. This was actually our first webinar of the year, and we're hoping to see you for furthermore. We'll have at least
Ah,
one every month. You can, keep an eye out on our social media for
yes.
more Wildlife SOS webinars. And thank you again, Adityan, for a wonderful session. And thank you, everybody else, for joining us. And we hope to see you again for more of our sessions as well. Thank you.
Thank you. Thank you.